Welcome our panelists to the discussion about vaccines and their safety. We have Dr. Ron Chapman from the California Department of Public Health, Jerry Collins Bride, clinical professor at the University of California San Francisco School of Nursing, Kim Mills, the CEO of A Better Life Together, providing services in San Diego County, Jesse Rocha, Director of Consumer and Support Services for South Central Los Angeles Regional Center, and Jaynette Underhill, Executive Director for Clausen House, providing services in the Bay Area.
Professor Collins Bride, we've heard a lot of concerns about how quickly, the available vaccines were developed and approved. Can you explain how scientists made sure the vaccines are safe, and what exactly is emergency use authorization?
Okay, so let me try to tackle that. The vaccine, the way that the vaccines are developed has actually been, that process has been ongoing for the past 10 years. And so it's not a new process, but what I think happened this year, and Dr. Chapman can correct me if I'm speaking out of turn, what happened is that some of the regulations that were roadblocks that took forever to actually get a vaccine to market, those were looked at as not necessary in terms of safety, but were actually perhaps unnecessary. So some of those roadblocks were sort of lifted so that the vaccine production could happen in a much faster way. I know people are concerned that it was developed so quickly it can't be good, but actually the process of development was many years.
The emergency use authorization got rid of all those bureaucratic barriers that existed for years, which really helped expedite in this extraordinary circumstance of a huge pandemic. And
what has South Central done to try and help, communicate the value and the impact of vaccinations?
Yeah, I think our center initially, when we were given the directive from the department to connect with all of our families, prior to that, we had a lot of families who were contacting the regional center, asking questions and getting assistance. So some of the things we did, the first thing we did was we put together a presentation to provide that information to our families. And one of the things we learned is that many of our families were able to absorb the information better when we presented it in the language that they prefer and in their own language. So I think that's very important. It finds that they obtain the information a little more and they kind of understand it much better than just being a basic translation.
Awesome. Jaynette, I know one of the things that you did for the community in Oakland was to actually host your own clinic. And so can you sort of talk about how that went and how people felt about that process, and if people had, I'll say, hesitancy, as they came in to that process?
Yes, I'd be glad to. Thank you for that question, Will. We were really afraid in 2020. What we did here at my organization was we decided very early on to channel our fear into becoming more informed to the extent that we could from every layer of my staffing on what exactly is this and how can we prevent. So when the vaccines came out, we were actually in our organization pretty excited about it. There was very little fear around it. And I think that was because we spent a great deal of time preparing for it. And that's what I would share.